This morning I presented the data of the refined study arm 3 that included patients who are JAK inhibitor naive. And these are patients with primary myelofibrosis and secondary myelofibrosis, intermediate 1, intermediate 2, and high-risk disease. And we found that the SVR35, that is spleen volume reduction 35%, has been achieved in more than 60% of the patients at the time of 24 weeks, so very earlier. And more than 70 obtained this endpoint during the study. That's quite important. The second point is that we obtained total symptom score reduction in a large number of patients. But what I think that is quite important is that we obtain anemia response in 40% of the patients, and we obtain reduction of bone marrow fibrosis equal to or more than 1 grade in around 30% of the cases. And I think that this is very important because there is a demonstration of biological activity. And we have also the same demonstration of a reduction of bone marrow fibrosis and reduction of JAK2 allele burdens also in patients who fail ruxolitinib, so the second line. And in those patients, we have already demonstrated that reducing fibrosis or reducing JAK2 allele burden may impact on overall survival of the patient. And if we have to discuss about safety, we observe a grade 1, grade 2 GI toxicity that is manageable, and grade 3-4 hematological toxicity, thrombocytopenia first. But we know that this is expected treating patients with Navitoclax due to the effect on apoptosis. And it is manageable and reversible. And then we have also grade 3-4 anemia and very rarely grade 3-4 neutropenia. But overall, no bleeding, no severe bleeding, and no safety issue treating patients with Navi plus ruxolitinib in first line.